Hi everyone, welcome to Follow Your Heart here on the Natural Parent Magazine. I'm Cullen. I'm talking about nipple shields today. They have become so common in the last few years especially. I've noticed more and more moms are turning to nipple shields due to damage of the nipple and painful feeds. And we're even being told often while we're pregnant to make sure we have nipple shields in case we need them once baby arrives. What I want you to understand is that often once you start using them, baby really becomes dependent on them. So they really need to be used as more of a last resort. And certainly if it is going to mean feeding baby at the breast versus putting them onto a bottle or having to supplement some other way, then I'm all for you using a nipple shield if it's going to protect your breastfeeding. But remember that what you really need to do is make sure you understand how to best latch and position your baby before they arrive. Really look into laid back feeding, and I talk about it on here quite a bit. So really make sure you understand how to position yourself and your baby for those first early feeds. Use lots of skin to skin. If you're having breastfeeding problems, use skin to skin. Get baby undressed, get your top off. This is a beautiful way to really elicit those natural reflexes in baby, get you more relaxed, and you'll both be in tune with each other. So this is always the first kind of thing you need to be thinking of when you're starting to have a bit of pain. And damage can happen pretty quickly, so we want you to get onto it pretty fast. So how much pain is normal? Yes, breastfeeding at first can be a bit uncomfortable, especially for those of you who are first-time breastfeeders, but actual pain should not be happening. One thing you want to look at is the shape of the nipple. When baby comes off and unlatches, is the nipple shape still more rounded, or has the nipple gotten squashed? So this is what we want to be paying attention to. Now, for those of you that have very flat nipples or even inverted nipples, so your nipple actually kind of turns in on itself, this is a time that maybe nipple shields are going to be necessary for a little while. Maybe even from the very beginning, maybe not the first feed, but really soon after. So please remember, if you've got inverted nipples, that this doesn't mean breastfeeding is going to be impossible for you. It's certainly possible. Sometimes your nipples just need a bit of encouragement coming out. So baby latching on effectively, drinking is the best way to do that. But sometimes we do need to use a pump or something else to help draw the nipple out before the feed. So that might be something to consider. If you're really just struggling and there just seems to be no other way and you're using the nice laid back position, by all means use the nipple shield. But and also being careful of just keeping that nipple dry and damage free. That can sometimes be problematic with inverted nipples. So I want to also point out, if you're using nipple shields, to please make sure, as with all babies, they're gaining properly. Make sure you know what it looks like when your baby is properly drinking and what it sounds like when they're swallowing. So we want to be gauging, is baby actually transferring milk? Is baby actually drinking at the feeds or just falling asleep? So obviously weight gain can be part of that, looking at proper weight gain. And are there 2 or 3 poos a day, at least, in those first few weeks? That's also a really, really good indication if feeding is going well or not. If you're concerned about any of this, if you're feeling already dependent on using a nipple shield, make sure to get one-on-one support as fast as you possibly can. It's really urgent to get help soon, because we can often help just tweak things a little bit, and it's much easier to help you on day 3, 4, or 5 than it is on week 3, 4, or 5, or month 3, 4, or 5. So please get help as fast as you can. I'm one of those people that can help you even with online consults, so just please get in touch if you need that extra support. Now, if you're trying to wean from nipple shields, One of the best suggestions is just to get baby latched on, feeding with the shield, and then take the shield off once baby's had a little bit to drink and has started to relax into the feed. What we don't want to do is frustrate baby at the breast. Anytime we're frustrating baby at the breast, or we're getting frustrated and worked up, we're just kind of creating, a negative cycle, a negative connotation with the breast. So we really don't want to do that. So if your baby needs the shield to latch on because that's what they've gotten used to, then that's okay. Try to remove it once the feed has started. Just keep offering the breast. Use your skin to skin time. So I often get my clients to keep baby skin to skin or just laying on the chest so that it just becomes a pleasant, nice place to be, and we take off the pressure of it only being a feeding place. So I hope some of that helps, and we'll keep talking about this, of course. And I really hope that, like I say, you're getting some support to try and get your feeding issues sorted before you get too used to using your nipple shields. And if you are using them, just do your best. Keep offering the breast to the baby without them, and eventually most babies do start to feed without them. So until next time, thanks for tuning in. Bye everyone.